I am going to start recording now. So, okay. So let's, I sent you guys the PowerPoint, right? Everybody got the PowerPoint in one of your announcements, correct? Has anybody had a chance to take a look at it yet?
The orientation one?
Yeah. Yeah. Also, to mention up front, there were 2 extra little exams quizzes you guys need to do. One was for the syllabus and one was for technology literacy. And my understanding was you couldn't access course materials until you did at least the syllabus one, right? Is that correct? So for those of you that did it, I assume you can access what the module, everything. For those of you that haven't done it yet, and there's quite a bit of people that haven't done it yet, what have you been able to access? So let's see. Octavia, you've done it. So you have access to everything, correct? The modules, the announcements, everything. Yes. For those of you that haven't done it, what do you have access to? Do you have access to the announcements?
I think before I took mine, you could see the announcements, but everything else was grayed out under week 1 through whatever was listed.
Okay. So for all of you that have not done the syllabus, I think the syllabus is the one that's tied to not being able to see the class material. Does everybody know what I'm talking about?
Yes.
Okay. All right. So for those of you that haven't done it, you haven't seen any of the course material then, right? You haven't seen the syllabus, you haven't seen the modules, you haven't seen what's due this week. Is that correct?
We can see, well, I can see what's due, but I can't access the PowerPoints because I haven't did some other stuff on there.
Okay, so I'm just trying to get a feel for the people that haven't done this syllabus quiz. Can you even access the announcements? The answer is yes.
Yes.
Okay, but beyond the announcements, there's nothing else.
Right.
Okay, so my suggestion to I only have a handful of people that have done it. So that tells me that most of you haven't been able to look or have any access to the course. I would suggest that you get that done sooner rather than later, because you probably want to start taking a look at, the syllabus and what's due and when, and kind of go through the course, go through the modules. So, okay. So I would get working on that. I don't think, for those of the few of you that did it, how long did the syllabus quiz take?
Not long at all.
Maybe 2 minutes.
Okay. So you guys need to get on there and do that. Daniela, could you turn on your camera, please? Thank you. We need to keep our cameras on. Okay, that's one of the things we'll cover in this orientation PowerPoint. Okay, well, let's go to the orientation PowerPoint. I'm going to share my screen. Does anybody have anything else? No? Okay. Okay, can everybody see that?
Yes, ma'am.
Okay, great. Okay, so this is our updated April 22nd, April term 2022 orientation to online nursing courses. Now, as you guys know, with each class you have, so with Med-Surg 2 and with PEDS, your instructor is required to go over this PowerPoint. So, right? So you know this from last semester, so you'll hear it 2 or 3 times. All right, so you might pick up a question for me in this class, going through the PowerPoint, and then you might have other questions for your other instructors, but it's all the same PowerPoint. Okay. So let's get going. Okay. So what is online learning? Okay. Why don't you take a look at these 6 bullets and let's see if you have any questions about them. I'm not going to read through all of them. I would like for you guys to read them and let me know if you have any questions. Anybody have any questions? Okay. You should be familiar, obviously, with what online learning is. Okay. Who do you contact if there are issues? Okay. We want you to start with me. Okay. And you all have copies of this PowerPoint so you can refer back to it. Okay. So we want you to start with me. And with me, what I'm going to try and do is you have in your campus shell a link to student resources. And there is lots and lots and lots of resources that you guys have. And so I'm going to, when you start questions with me, I'm going to possibly refer you back to your student resources to get the assistance from that section as well. Okay. But start with me with asking your questions. If I can't answer your questions, I'll reach out to my course lead, who down here, this is a good slide to copy and paste somewhere. Okay, these are two people that you want to have their contact information besides me. Okay, one is our course lead, who is Dr. Annalena Lundy, and here is her email and her phone number. Okay, and whatever I can't help you with, I will reach out to her for help. Okay, and then the next person on the list is our dean, our National Dean of Online Nursing Education, which is Dr. Brown, Darlene Brown. And she is the one who sent you that long announcement. Okay. So put that on my instructor page, get to know your instructor. At the bottom, I have Dean Brown's information as well. Okay. Okay, so your online instructor, who's me, is the first contact of any issue, available by email, Canvas messaging, and by phone. Okay, I sent you a syllabus cover sheet in your announcements, and that listed the, when the course is. It listed virtual hours, office hours. I always list my office hours as the hour before class. Just so I can be online if anybody wants to schedule an appointment. But know that I am flexible. I am available pretty much all the time. Okay. So I can meet with you guys morning, noon, and night. Okay. But for purposes of the class, on our syllabus sheet, we have to put what our office hours are. So you always use the hour before class. And if you would like to utilize that, that's fine. Just let me know. Okay. Do you guys know about the online, the specific start times and end times, right? Do I need to review this with you? Okay. Everybody knows we start on Mondays and end on Sundays. Okay. In this course, well, you have things due on Wednesdays and Sundays. All right. So we need to be mindful of what weeks things are due on Monday, like the discussion questions and then mostly, and everything else to do on Sunday. Right. And that's all in the modules. I'll show you that. Late work policy, it's the same as last term. Okay. Submit on time. Okay. And a lot of students forget this. Late work is only accepted with prior approval. Okay. If you could just, for me, I'm really, to be honest with you, I'm really easygoing, really flexible, really open. And so I just ask that you communicate with me. That's all. It's that simple with me. Just let me know what's going on. Okay. And I'll work with you. All right. So I really need to know if things are going to be late. Okay.
Miss Marvel.
So,
I'm sorry to cut you off, but Gabriella internet just went out, so I guess she's gonna try to log back in.
Okay. Okay. Thank you very much. I appreciate it. So as last term, 1 to 7 days late, you get 1 week to complete it. Okay. So weeks one, so your professional development plan is due on Sunday, this Sunday. If you're going to be late, number one, you got to let me know. And number two, you would have 1 week to complete it. Okay. And that 1 week, you would have a 10% deduction. Okay. After the first week, it can't be turned in. So it's the same as last term. That's not new. Okay. And again, I just simply ask for communication. It's really simple with me. Okay. Late work. Let's see. Attendance. We know that this attendance is taken with student submissions. Okay. So everybody has to have 2 student submissions per week. Okay. And this is just like last term as well. Okay. So we have to be careful about working ahead. Okay. Because if you're working ahead, then when you're working on things ahead, that gets counted. Let's say you did all 4 NCLEXs this week or next week. When week 2, I think it's week 2, we have our first NCLEX. Let's say you did all 4, week 2, week 8, week 10, or week 2, 5, 8, and 10, and you submit them. Well, those all get counted for week 2. Make sense? So it's fine to complete them, but just maybe not turn them in. Don't submit them yet. Does that make sense? You have to be careful. Okay. We have to have 2 submissions a week, and your 2 submissions, obviously one is your online, is your attendance. We're attestation, right? Which we all know what attestations are, that are due within 24 hours of the live session. So by the end of tomorrow night, well, technically it would be, 3:00 tomorrow afternoon, but by the end of tomorrow, you guys have to complete your attestations. They're due within 24 hours. What I like to do in class is I like to do the attestations the last 5 or 10 minutes of class so that we get it done in class and nobody has to worry about it. You don't have to worry about delaying it and getting it submitted the next day. So I like to do that, and it's worked. I've done that for a couple of terms, and I think students have appreciated that because it's one less thing they have to worry about. Okay. And so we must have 2 submissions a week. So obviously the first is your live sessions. If for some reason you're not going to be at the live session, you've got to let me know. Okay. Because I will invite you to join my other 2 sections. I really believe that the live lectures are the best. Okay. To get to a live lecture. Within a couple hours after class, I'll always send you the recording that we do in case you want to listen to it again, or if you've missed class, you'll have to listen to it. But for students who are going to miss a class, I always offer them to come to my other 2 sessions. And if you want to write this down, I teach tonight. I teach 2 classes on Mondays. Okay, so I'll be offering you it's 8 to 10 Eastern, which is kind of late, but 8 to 10 Eastern. And then I teach on Tuesday mornings from 9 to 11 Eastern. Okay. But if you're going to come to one of those classes, you got to let me know. Like if you have a conflict, temporary conflict, I don't know, whatever, doctor's appointment or, something, and it's a one-off, I'm totally okay with it. Let me know. But you can't just come to one of my other classes routinely. Okay. You've got to attend this class, but I can be flexible and work with you if you need to attend another session any given week for a particular reason. Okay. Okay. Some other submissions that will count as attendance are your NCLEX questions, your case studies, your projects, papers, discussion questions, Kaplan. We don't have any quizzes. There are no quizzes in this class. We have 3 exams. I'll go through that when we get to the KGAs. Anyone without posting attendance in 14 days will be dropped without notification. Again, that's the rule. Okay, if it's not documented, it's not done. Okay, so these attestations you have to get done. Okay, that's the proof that you attended class. Okay. Questions so far? Okay, here's the addition. Here's the added slide. Cameras need to be on at all times when in class. Number 1, you're not allowed to be in class if you're driving. Safety first. And that even means pulled over. That doesn't fly. You need to not be in your car. Okay? You're not allowed to be logged on while at work during your scheduled class time. Okay? So we have these have been in place all along. To the extent of the enforcement, it's been kind of, everybody enforces it differently. This term, we are being encouraged as faculty to very much enforce these. So does anybody have any questions about this slide? Because it's really important that if you do have questions or issues, we got to talk about it. And if you'd like to talk about it with me privately, that's perfectly fine. Okay, just send me an email. We'll schedule a Zoom time. Okay, I can schedule a Zoom in a couple of minutes. Okay, I don't need that much lead time, but I'm happy to meet with you if you have issues with any of these three. Okay, and we have been asked that if any of these three things are going on, we have the ability to just remove you from the Zoom. Okay, and I don't want to do that. I really don't want to do that. Okay, any questions on that? Okay, you guys you're at one semester away from graduation, right? You have one term after me, right? So I would make the assumption that you're already practicing these 7 key steps to success. Okay, so why don't you have a look at those and let me know if you have any questions. I can't stress enough number 5. Okay, read the directions and the rubrics to all your assignments. Okay, that's how I grade. That's how we grade. We grade on rubrics. So really have an understanding of the rubric. Take a look at your professional development plan that's due this week. I sent you the rubric, and I even sent you a template. Right. So for those of you that haven't opened your announcements yet, go into your announcements. Though I think it was, well, we'll get to the announcements. We'll find it, but know your rubrics. That's how I grade. That's how everybody grades. Okay. And you all know about completing all assignments, right? Everybody knows that you can end up with a 78 in the class, right? And homework, the non-submission of homework can have you fail the class, right? Everybody knows how that process works. And I didn't have anybody last term that fell into that trap. So it's just I think, in my opinion, this is a very manageable class. Okay, it's a 2-credit class, and our workload equals a 2-credit class. Okay, the assignments, the workload, it's a formula. We can only do so many hours of this and so many assignments. So this is, I guess I could say this now, but I consider this class, it's very different from your other classes. This is a class that I hope you kind of sit back and enjoy. If you get your readings done and come to class and do the assignments, you're going to be fine. Okay, this is not a class. This is a class you have to pass to move on. Okay, this is, in my opinion, this is not a hard class. It really isn't. It's different. That's what it is. It's different. Okay, this isn't in the hospital, peds, OB, mental health. I mean, we're out in the community now. We have to think, when you come to this class, I want to take off all your hat, take off your work hat, whatever you do, take off your hospital hat. And this is a community class. We're out in the community. Okay, very different from the inpatient hospital setting. So I think it's a nice break for you guys. And the feedback I get from students at the end when we're talking about, what did you learn? Did you enjoy it? Very, very positive. It's a really kind of not laid back class, but it's just different. So I hope you take the opportunity to embrace that. Okay. To be successful, keep in contact with me. That's really, I mean, that's my only really game changer is communication with me. Okay. I respond to emails, I respond to calls very quickly. Okay. You have to keep in contact with me, especially if there's issues. Have a reliable internet connection. We all know about that. Maintain some kind of a schedule for completing your schoolwork. You know, I always tell students in this class to just designate a couple hours or whatever time you need for community to get done at the beginning of the week. And then you're done with community. And then you can focus on your med-surg and your peds. You know, I do hear a lot of students saying this is a really hard term when you have med-surg and peds along with community, but don't blow off this class. Okay. There are some things that need to be done, but if you just block out a little bit of time, some time to get your community tasks done, you'll be okay. Okay. Quiet place to complete work, read all assignments, log into class 4 to 5 times a week. I use the announcements for everything. Okay. You're going to get an announcement from me every couple of days about something. In fact, look at how many I already sent. I didn't mean to send you guys already. I was going to wait till next week, not to overwhelm you, but I sent you a couple of math resources and APA resource announcements that are really helpful. You know, you don't need to go through them this week if you don't want, but I would have sent those out next week, but they got out this week. So, but those are really helpful resources. I like to provide you guys as many resources as possible for you to be successful. Okay. Review course announcements at least weekly. I would say every couple of days. Do you guys get alerted when I post an announcement, correct? Yeah. Okay. Submit all assignments when they're due. Okay, including discussions. I grade early. So if you guys turn in things early, I'll start grading them. Like if I start getting professional development plans in the next couple of days, I'll start grading them. I have three sections, so I like to stay on top of my grading. Okay. With the discussion questions, with those initial posts that are due on Wednesdays, if you haven't submitted your peers, then I don't grade that yet until your peers come in because I have to grade it all together. But, you know, if by Thursday or Friday your discussion post is in and you've done a couple of peer responses, I'll start grading those. Okay. So I'm happy to grade early. And because you have until if something's due Sunday, and if you submit something and I think you could do better, I might send you an email and say, hey, take another stab at this. And, you know, like NCLEX questions. If you score below a 40 out of 50, if you're in the 30s, I like to reopen it for you and so you can take it again. Does that make sense? Before the Sunday deadline, just so that you can learn from the rationales and that. So, and it's up to you. You don't have to retake it or you don't have to resubmit, but if you turn it in early, some students last term would submit a paper to me in the middle of the week and say, I know it's not due till Sunday. Will you take a look at it and see if I'm on the right track? Sure. Happy to do that. Okay. I like to review this number 9 towards the end of each week, review the assignments for next week. I like to review the module for the next week during class. So we'll go through module 1 and 2. And then don't procrastinate. You guys know all this. Day 1, the difference here though, getting started, keys to success. The difference here is for those of you that haven't done the syllabus quiz, you've got to get that done in the next couple of days. Okay. Because the other thing too is if you can't get into the modules, you can't see what the rubric is for the professional development plan that's due on Sunday. But I'll show you that when we get to the modules. I need to know if if anybody's having an issue with accessing the textbook. Okay, it should be right in your shell. Has anybody opened the textbook yet?
Yes.
And any problems, Sarah?
No, I haven't had any problems with it.
Okay. So let me know if you are having problems, but that would be a test this week to open up open it up to make sure you can use it. And also the PowerPoints, everything's connected in this class. So you have your textbook. The PowerPoints are developed from the chapters. Okay. The case studies that I send you are developed from the chapters. It's all connected. So when we review the book, the PowerPoints and case studies, it's all connected, meaning all the information, it's not 3 different pots of knowledge that you need to know. It's all the same pot of knowledge. It's just presented in 3 different ways. Does that make sense? Okay. There's 32 chapters in this course. Yes, we will cover every chapter, but there's certain concepts in each chapter that we'll pull out. And that's what we need to know. We don't need to know everything. And I try and really focus in on the concepts that we need to know.
I have a
Okay.
question.
You bet.
You were talking about the textbook online. Is that a different book than the hard book that we were given?
What hard book were you given? It's the foundations. No, that's it. Oh, that's great. You guys have a hard book. Does everybody have a hard book? I think, do all campuses have hard books, or are they online? That's great. It doesn't matter if you have it online or hard book, as long as you have access to it. Click on instructor information, write down my contact information. That's totally up to you. But again, I would have my information, Dr. Lundy's information, and Dr. Brown's information. Print or save the course syllabus. That's up to you whether you access it online or print it. Confirm that you are giving the correct textbook and edition. Questions, missing something, contact me. Mandatory live review sessions. We review key complex course concepts. Provide students the opportunity to interact. I don't like to hear myself talk for 2 hours, and they're not going to want to listen to me talk for 2 hours. I really like interactive. I like for students to be an interactive session. I really do. All right. So if everybody's quiet, I hate to call on people, but I will, as to prevent me from talking for 2 hours. Okay. Participate. If you're having technical difficulties logging in, contact technical support or your instructor. Weekly review sessions, not mandatory, but highly encouraged. So weekly review sessions, we work with students one-on-one if students want that. Usually the students that I try and meet weekly with all the repeat students. So the students who are taking this for the second time, I try and meet with you weekly, whether it's tutoring or just checking in. It doesn't matter. Like I had a group of repeat students last term from a campus, and they were like 5 students from a certain campus. They all pulled together and decided they were going to work to pass this course. So they were all, like exam 1, they were all in the 80s and 90s. Exam 2, they were all in the 80s and 90s. So I was only checking in with them weekly to see if they needed any additional support, tutoring, which they didn't because they were all doing great. Does that make sense? So we can do one-on-one tutoring if we need to. Okay. But if you're attending class, if you have poor exam grades, right? But if you're attending class and doing the homework and doing the papers, you should be okay. But know that there's tutoring offered. Okay. Weekly review sessions. I don't do weekly review sessions. I do the 2-hour lecture. Okay. And then during exam weeks, that's what we're talking about. So weeks 2, your exams are in weeks 3, 6, and 9. Okay. So on weeks 2, 5, and 8, we do review sessions for you. Okay. Does that make sense? So for example, we met as a faculty last night. We already have all our review sessions set up. And so I'll be sending you guys an announcement with the review sessions. I can already tell you that at the end of next week, that we do our review sessions on Friday, Saturday, and Sunday. Okay, we do 2 Friday, 1 Saturday, 1 Sunday. It's done by 4 different instructors. So you have an opportunity to get 4 different learning styles, and it's all the same information, but learning styles, right? I'll send you out that schedule, but those are the review sessions we're talking about. Okay, so weeks 2, weeks 5, and weeks 8, you'll have the opportunity to attend an additional outside of the classroom, because we don't do our reviews during class. Okay, so it's an additional attendance on Friday, Saturday, Sunday, on the weekend before the exam. And you guys have the exams on Monday, so that works out, for a Monday class, right? And then you can attend one, you can attend all 4, and then you'll get recordings of all of them. We share our recordings with each other, the instructors, and then we post all our recordings. So we think that's great. We think that's a great resource we provide to you for preparing for exams. Make sense? Okay. Students who participate actively in these 2 resources tend to have higher testing scores. I'll tell you what I've learned is, what I've seen is students that attend live review sessions, those Friday, Saturday, and Sunday before an exam, will do better on the exams. They really will. Versus just listening to the recordings or not doing anything. Okay. I'm going to skip this because this is generic. This is every professor is reviewing this same PowerPoint. This is a generic one, and we have one made up for community. But know that, oh no, wait, it already got in here. No, this is it. Okay, so slide 15 is on your syllabus. Okay, so 80% of your grade is 3 exams in weeks 3, 6, and 9, and then the HESI. Okay, so this is on your syllabus, in your syllabus. So all your 3 exams are worth 20%. Exams 1, 2, and 3, 20% equals 60, and then your HESI is 20. And your homework, you know how that works. The other 20% is split up between all of this. So you got to get your homework turned in because, where's our professional development plan? Okay, that's due this week, 2%. Vulnerable populations, which is due in week 9, which we'll talk about. That's worth 8% of your grade. Okay, and then your case study, which is due in week 3, which we'll talk about today. Your NCLEX questions, you're going to have 4 sets of NCLEX questions, each worth 50. 2 case studies, which I've already uploaded into your modules from Elsevier. We'll have a Kaplan in week 11, week 10. And then 4 discussion questions. There's 3 that are by yourself, and then the last one is in your groups. We have a couple of group activities in this class. Okay, so this is all in your syllabus. But you have to be mindful that it's only 3-unit exams. So if you don't do well in the first exam, I can tell you right now, you're playing catch up the whole term. Because if you don't do well in exam 1, then you have to wait till week 6 to bring up your grade. Does that make sense? And there's a point in time where I turn on homework grades. I'll show you where that is. 20% homework or discussion questions, NCLEX, case studies, Kaplan. Okay. Oh, here it is. So weeks 1 through 5, homework scores will be turned off. In week 6, I'll turn them on. And you know why we turn them on. Why do we turn them on? You tell me.
So we can see where our grade stands.
And you can see what? How your homework or lack of
How it affects the grade.
is affecting your grade. right? So if you're sitting at an 80 for a grade and I turn on the homework, you might be down to 75. Well, you can't do that. And remember, the other thing too, it's critical. You only have 1 week to turn this stuff in. Okay. So week 6, we'll turn the scores on so you can show the impact. Week 8, we turn them off. And going back real quick to reviews, I told you about the reviews for weeks, exams 1, 2, and 3. Week 10, and this is on the syllabus, but week 10, just so you know, we use the entire class time to do a HESI review. Okay, we're done with the content in week 9. Okay, so week 10 is used just for HESI. And we also give you the opportunity to attend any of the other 11 sections that week. You have to attend this one because this is your regularly scheduled class, but we give you the opportunity to attend any other professors, any other instructors sections all through the week. Okay, and that's when we do recordings of, and we send them to you guys. So you have 12 sections and 12 recordings, so plenty of opportunities. Okay, and then once we turn the homework off, so between week 6, 7, for 2 weeks, you'll have it, homework. And then week 8, we turn it off and don't turn it on until after HESI. Okay. Do you guys know this? Read these 2 bullets. Do you know this rule of thumb? Please. Are we all familiar with this and what this means? Your homework is only, the extra 20% is only included if after your 4 key graded assessments, which are your 3 exams and your HESI, are at 78. Right? Okay, anybody, any questions? This is a really important slide, slide 17. Does anybody have any questions about that? Okay, exams, there is nothing different about from last term to this term about exams. Nothing. Okay, ExamSoft, have to make sure. I always tell people at the beginning of the term, you know, between now and next week, please go in and double check your ExamSoft, make sure everything's working, make sure you can sign in, so that we don't run into issues in week 3. Okay. So you should be familiar with every bullet point on this, this slide. Okay, so I would encourage you to go in and just double check your ExamSoft, make sure your account hasn't been wiped out, or make sure you can sign in. Okay, and I do the same thing with exams as we did last term, that the expectation is that you upload or download the exam before you come to class, right? So I'll be opening the exams for you guys. I usually do it on a Saturday morning before the exam. So you have the weekend to download it. Okay, but you got to have it downloaded before you get to class so that we can make sure there's no issues. And if there are issues, we can work on them over the weekend. Okay. If there's anybody with accommodations that if you would please notify me at the, like in the next couple of days. Okay, and provide me the paperwork because I have to get that to Dean Brown. Just because you had an accommodations last term does not mean we know about it. Notifications less than 10 days before an exam may not be able to be granted in time. Okay, the expectation is that you take your exam during the class scheduled time. Just because I teach 2 more sections, you can't say, hey, could I just take it Tuesday morning? There has to be a good reason that you're not taking the exam at this scheduled time. Okay, and it's in red here. Exceptions are only with written approval by the faculty and copy to Dean Brown. So if you cannot take the exam at this time, Dean Brown needs to approve that. Okay, and then exams just like last term. Okay, we proctor them online. I did have a couple students last term that wanted to take their exams on campus with a professor, and that's fine. Okay, so exams can only be proctored. So look at this last bullet. Exams can only be proctored with a faculty member on campus. I need to have 72 hours notice. It must be done during a scheduled class time. During the scheduled class time. So you still have to do it today, but you can do it on campus, but that would have to get set up last, I don't know, Wednesday or Thursday, because I have to be able to contact that instructor. I have to give her the passcode for the exam, and I have to give her the troubleshooting information in case there's an issue. Make sense? I did have a couple of students last term who took advantage of that. They're proctored. Exams are proctored. You guys know the drill. You're on camera, have to show me your ID when we start. We look at your working environment. Where no hats, no headphones, no calculators, all that, right? Don't assume that I know all of your individual requirements. If there's something going on that you need accommodations for or something for an exam, please let me know ahead of time, okay? Missed exams will be held to the late work policy. Right? Missed exams without prior notice, if you just don't show up, is automatic 0. But if exam is missed for personal reasons, will result in a late penalty, which is the 10%. Okay, missed exam due to an emergency will require documentation of the emergency. All right, and you get this to me, and I send this on to Dr. Brown, Dean Brown. Okay. Notification must occur within 24 hours of the scheduled exam. Documentation must be presented prior to the exam being rescheduled, right? And again, it's the late policy, 1 week. Any exam not rescheduled within 7 days will result in a 0. Okay, so contact your instructor with issues that may prevent you from being successful on an exam before the exam, okay? We can work with you. As I've said a few times already, I am super flexible. I just need communication. Okay? And obviously we want you to be successful. And I look at this class, I look at my role. This is a team effort. Okay? I have my part and you have your part. Okay? It's a team effort to get you guys over the finish line. Okay, so I'll do whatever I can to support you guys, but I need you to do your part as well. Okay, contact me if you have any problems or if you'd like just some additional information. Let's do this part, homework assignments. Okay, I assume you guys are already practicing good planning strategies, planning, prioritizing, completing work, and submitting work. So if you want to go back and review this slide, number 25, you can. I'm not going to go through all of this. You guys should already be doing this. Right? Everybody plans and organizes in a different way. I like to use calendars. I like to use sticky notes, and then I transfer over to my calendar. Everybody has their own way of planning and organizing. Okay, so I always suggest at the beginning of the term that you go through the assignments and the modules and write down all your due dates and what's due each week, so that you know what's going on. The one thing I will say, though, and make note of this. No, let's do this when we get to the syllabus, but the 2 case studies, the hospice and disaster case studies, the HESI case studies, the due date on your module, I had to do a week later, like if you were late, but the actual due date, it's in there. So for example, look at this calendar. Let's say the HESI case study was due on the 12th, right here. I put the due date for the 19th because what I learned the hard way was if somebody's going to turn it in late and it's beyond the 12th, it shuts down. You can't turn it in late. So we put it in for the 19th, but we review with the students what the actual due date is. But I'll review that in the syllabus when we get there. We just talked, you know what the late work policy is. 1 to 7 days is 10% deduction, 8 or more, it's 0. And then first and foremost, late work, I can't accept late work without prior approval. I can't do it. NCLEX. Okay. Before we go through this section, you guys have done NCLEX questions before? You guys know how to do NCLEX questions? You know how to put in the subcategories, right? Has anybody not had experience with NCLEX questions? Okay. So I'm not going to skip it, but I'm going to ask you to review it if you need to review it, but I'm not going to go through this section.
Hey, Professor Marvel.
Yes.
The link to get to the NCLEX questions isn't in the modules.
Doesn't it say start at the top?
No, it has a submit, but there's not the start button that links you to get to the NCLEX questions.
Okay. Thanks. Can you get to it through your Evolve?
No, ma'am. It says it's unauthorized. You have to go through the course module.
NCLEX, good to know. Okay. Thank you, said Sarah. Thank you. I already talked about NCLEX. Once you submit it, that's the score you'll receive. However, like I told you, you can repeat the questions as many times as you like to obtain the highest score. You are the master and the control of what grade you receive. If you're going to submit me a 38, 39, I'm going to submit you an email back that says, here, you can redo it. I've reopened it for you. So once you submit, it's submitted. Okay. And I have to reopen it. Okay. Here's your case studies. Okay. Has everybody found your case studies? Well, some of you have, others have not because you haven't done the syllabus quiz. So for the case studies, there are 2, and this gives you how to access them. Okay. I've already uploaded the links into your modules. Well, I'll show you that when we get to the modules. Okay. So you just have to click on it and start them. I think they're in maybe week 4 and week 7, but we'll take a look. Case studies. You have to access these case studies through Canvas course module. In fact, everything needs to be accessed through the modules. Okay. There's a reason there's links to them. Please, please, please. I'll sort out this NCLEX link that Sarah talked about, but you have to access all of these through the Canvas course module. All right. Case studies accessed through your Evolve account will not be accepted without prior written approval. Okay. And Sarah, that's why you don't have authorization right there. I forgot about that. Okay. So we have to go through the course module. Okay. With your case studies, just know I get a lot of emails. There's no submit button. I can't submit it to you. Case studies are automatically populated into the gradebook. You don't have to worry about sending them to me. Okay. They're automatically populated. Okay. Access is required through the Canvas course module link. Only complete the case study for the link accessed. Okay, completing other case studies at this time will result in lower grades as well as missed attendance later in the term. And that's why I talked about working ahead. You got to be careful about working ahead. Okay, so I think there's 2 weeks that there's only like a live session and a discussion question. So if you work ahead and the discussion question is done, then you only have 1 attendance or 1 entry for that week. Does that make sense? There has to be 2. Screenshots, this is big. Screenshots are not accepted. Okay. They're just not. Right. Access by another method will result in 0 for the assignment. It has to be done through the module. Let your instructor know if you're repeating the course to have the previous work reset. Okay, so that's another reason to let me know. Review and follow instructions. You guys know how to read your modules, read your instructions, go through the module. Okay, follow your rubrics. Okay, your rubrics are all in there. Tips for paper and discussion questions. Okay, this is important stuff. You have to use, we expect you to submit your discussion questions in APA format. And I sent you an announcement this week that it has APA resources. You have APA resources in your student resources. Okay, only use nursing. I love to see other resources. I love to see other works cited from other than the foundations book. Okay, it tells me you've gone out and looked beyond your foundations book for additional information and resources and research for that discussion question. Okay. Summarize the key points in your own words. Give your rationale for your argument in your own words. And in your peer reviews, don't just say, great job, I agree. Just try and further the conversation. Read the instructions. We try and give you a suggestion. In your peer responses this week, why don't you address how, whatever. Okay, so read what we're asking you, suggesting you to do. The I agree, great job it's not going to fly. You really have to try. The point of the discussions is you read somebody's post and then you comment on it, but you try and further the discussion, right? Further the narrative. Okay. Taking quizzes and exams. What are we at here? You guys know how to do this, right? Opening your exams, right? We know how to do this. Technical, okay. Technical issues during exam. What happens? What are you supposed to do if you have technical issues? Right off the bat, what's the first thing you do?
Contact you.
Even before that, what do? Stop. Just stop. Stop the exam. Okay, do not continue or try and continue if you're having technical issues. Notify me, right? And then I'll help you problem solve, right? The one things that faculty will not do, allow a retake of an exam due to technical problems or other, pardon me, physical or emotional issues when the majority of all the questions have been answered and time has run out. Okay, I've had very minimal issues with exams, so I don't anticipate any issues with that kind of stuff. Kaplan, we're going to save for down the road. Okay, you have it in your PowerPoint and you go back to it. We don't do Kaplan until week 10 or 11. Okay, but the one thing I won't mention about Kaplan is an excellent sample of how NCLEX questions will be presented. Okay, so that's Kaplan. We're not going to go through that now. We'll cover it at the right time. If HESI at the end, we'll cover it at the right time. You guys know about remediation, right? You get remediation packets after your HESI. It's due the midnight Tuesday after the HESI of week 12, and we'll go through all of that. Okay. Exam security, we've already gone through that. I'll be sending out, we're working on updating study guide for exam 1. We're working on it like as we speak. We like to send out our study guides at the beginning of when the exam is going to cover. So for example, exam 3 covers weeks 1 and 2, right? So we like to get that study guide out sometime in week 1. Okay, so you have it and you can be reviewing it and checking off what's been covered, right? So, and for example, on exam 2, that's week 6. So exam 2 covers weeks 4, 5, and 6. So I like for you to have exam 2 study guide in week 4. Does that make sense? I like for you to have it at the beginning, the first week that the exam is going to be covering, so that you can see what's going to be covered, cross-check your notes with class to the study guide. Does that make sense? And in the next couple of weeks, I will be sending you out, I think we're trying to revise it as well, the HESI study guide. Okay. I like to send that at the very beginning of the term, so you guys have that the whole term and you can use it as a kind of a study guide, a term study guide. right? And the way I encourage my students to use the study guides is after we have a live exam, go into your study guide, highlight, check off what we've covered. What did we just cover? Right? Make sure you understand that part of the study guide of what we covered. Right? And then we move into next week. So by the end of class next week, everything on the study guide I should have covered. Does that make sense? That's how we really hone in and do our targeted teaching to the concepts we have to pull out of each chapter. Does that make sense? Okay. All right. I'm going to stop sharing for a minute. Just checking in with everybody. How's everybody doing? Helpful? Too much information?
That's good.
How we doing? We doing all right?
Doing good.
All right, let's go into our syllabus. Okay, I'm not the most technical person, but okay. Syllabus. Where did I put the syllabus? Where did I put the syllabus? Hang tight. Nope, that's not what I wanted. Syllabus. Oh, it's a PowerPoint, so it's in here. All right, here's our syllabus. Okay. I'm going to have you guys read the first page, okay, which is the course description. Well, we'll read the description, then you can read the student learning outcomes and the course objectives. Course introduces community health nursing, which is focused on historical development, philosophy, healthcare systems, epidemiology, and specific target groups. Primary, secondary, and tertiary prevention activities are emphasized as they relate to individuals, families, groups, and aggregates. We focus on transcultural and anthropological nursing concepts, as well as rural and home care, home health delivery. Diverse roles of the community health nurse are explored. So with that being said, I'd like to jump down here to the weeks and show you. Okay, before we do the weeks real quick, what do you guys think this course is about? What do you guys think community nursing is? What do you know about it?
Would it be nursing that's out in the community?
What kinds of nursing? What do community nurses do?
You might deal with more homeless patients, or you might work more out in the field, like home care, like check-ins and stuff like that.
Yep. Do you think you're going to be working with vulnerable populations?
Yes.
What kind of vulnerable populations?
Drug use.
What was that?
You said elderly, I said drug use.
Yep. What else? Just think about when you're walking around your community or walking around a community, what vulnerable populations are there? Are homeless people a vulnerable population? Are people with alcohol and drug addictions vulnerable population?
For
Yeah, that
Elder?
Yeah.
Who else? When you think about pregnancy, what about teen pregnancy?
And children, like kids in foster care, and you're basically wanting to improve the quality of life of these individuals and try to prevent illness or spread of illness.
What kind of roles do you think, if you're a community nurse, what kind of roles do you think the community nurse has? What kind of hats does she wear?
Education.
Wound
School
care.
nurse. School nurse, yep. That's what I did for 20 years. Yep, school nurse. What else? What about a hospice nurse?
Hospice.
She a community nurse? What about a home health care? She a community nurse?
What
What
about
about
the
a-
health department, like the nurses at the health department?
What about an immunization nurse? Yep. Public health nurse. What about a occupational nurse that works with workplaces. Is she a community nurse?
Mhm.
Yep. What about a parish nurse? She a community nurse?
Yes.
Lots of different hats. Community, in the community, it's much different than, admitting a pediatric patient with asthma to the peds floor, right? In the community, you're dealing with populations across the entire lifespan, from infants all the way to the elderly. You bring all your skills in your toolbox to community if you're going to be a community nurse.
And the nurse could be in charge of like wound care or nutrition or
Yep.
really
Yep.
any type of thing.
Do you anticipate there's a lot of education involved in community nursing?
Mhm.
Lots. A lot of coordination with clients getting discharged from the hospital back home. Who gets them set up in the home with what they need? The community nurse, the home health nurse, right? Lots and lots go on in the community, right? You bring all your skill. I mean, a lot of our exams, and you'll see this on the study guides. This is med-surg focused as well. You have to bring your med-surg skills into community, right? Because you're doing assessments. You have to be able to take your ADPI, right, and think about it in terms of community. What does assessment mean what is an assessment? How is an assessment different from an OB patient than a community patient? So a couple of the big things that we need to be able to hone in on in this class is being able to use your ADPI in all these different settings. So how does a hospital nurse use ADPI versus how does a hospice nurse use ADPI? How does an occupational health use ADPI? How does a parish nurse use ADPI? The concept's still the same. We all use the nursing process, right? But how is it applied in all these different settings? Okay. And the other thing we're going to hear all about in every chapter is primary, secondary, and tertiary interventions. Have you guys heard those terms yet? Yes? No? What? You guys know what they are? Okay, we're going to get into that. You're going to know what a primary, secondary, and tertiary intervention are. Backside, all the way around, you're going to have, that's one of the key things we need to know. It's addressed in every chapter. So just like you would have to take your ADPI and apply it to all these different areas in community health, you're going to have to take your primary, secondary, and tertiary interventions and apply it to all these different areas in community health. Okay, so we'll get into this, but for example, primary interventions are, well, that's one of our attestation questions. What's primary care? What's primary care? Education, prevention, right? Primary care. So primary, we think about it in terms of education, prevention. So classes to prevent, talking to kids in high school about preventing obesity before it happens, right?
Like to prevent disease before
Yeah,
it happens.
prevention, that's primary care. Secondary screening. We're going to talk about this all the time, but secondary we consider screening. So early intervention, early identification. Okay, and then tertiary is they already have the disease, the issue. How do we help them manage it? How do we help stop the progression? Okay, but we need to be able to apply those general concepts to all the community areas. So ADPI, primary, secondary, tertiary, and then we're really going to get into Healthy People 2020. Okay, it's in every chapter. Okay, Healthy People 2020 was developed 20 years ago, 30 years ago, and it's a grand plan for community health. We'll be talking about that. Okay, and there's questions on the 3 exams about all these 3 things. ADPI, lots of primary, secondary, tertiary, so we have to have an understanding of it. I'm just introducing the language. Okay. All right, let's go we're going back to the syllabus. Okay. So here's kind of a summary of what we just talked about. Look at all these topics. That's all I really want to do in this section. Look at the topics we're covering. Okay. So what is community? This is week 1. What is community-based nursing? What's the history of public health? What's a healthcare system? What are vulnerable populations? Okay. Week 2, the school nurse, healthcare issues in communities. A lot. Do we think there are a lot of healthcare issues in communities? A lot. Okay. Family health risks. Okay. We look at the community as either individuals. You might be working one-on-one with individuals. You might be working with families as a group. You might be working with certain populations within the community. So it's all over the place who you could be working with, right? So we have to be able to identify who is our community as an individual, who is our community as a family, who is our community as an aggregate. Okay. So week 2, school nurse, healthcare issues in communities, family health risks. What is common childhood ailments, safety concerns? Okay. Week 3, we talk about special populations. Those are our 4 vulnerable populations. That's your homeless, your teen pregnancies, your HIV. And then we do a case study. Then we talk about home health and hospice nursing, faith community nursing, right? Week 5, we get into environmental health. I mean, think about environmental health in your community. How much do you know about your community? Do you know what environmental health risks there are in your community? Government and law, how that plays a part in community, economic influences, right? How do you do a community assessment? Right? What does health education look like in communities? Violence and human abuse. Big, big, big topic in community health. Okay? Trafficking. Violence, abuse, infectious disease, prevention and control. In community nursing, we do the surveillance. Right? Then we talk about disaster management, outbreak investigations, quality and safety. How do we do that in the community? Ethics, cultural influences. Think of all the different cultures you will be taking care of or communicating with. So we have to be culturally competent, right? Okay, week 9. I need you to take a note. Get your pen out. I need to tell you guys what's happening here. Okay, even though week 9, we're going to change this for next term. We couldn't get it in for this term, but week 9 is an exam week. Okay, and we still have chapters to cover. And there are some questions on these 3 chapters that are in exam 3. So we are going to be covering these chapters in earlier weeks. So let me tell you what we're doing. Chapter 7 is going to be covered in week 6. So when you get your PowerPoints and case studies, you're going to be in week 6, you're going to have week 7 in there. Does that make sense? Chapter 8 is going to be covered in week 7. And then chapter 10, which is our evidence-based practice, is going to be covered in week 1. And I haven't sent you week 10's PowerPoint and case study because I didn't want to confuse you. I wanted to let you know, because I would have started getting emails saying, chapter 10 is not in our syllabus for week 1. Okay, does that make sense? And so we're going to cover those earlier. Make sense? So that week 9, because think about it, when we do an exam week, we miss the whole lecture part. So we either do a recording or we cover it the following week. All right, so I want to mention that. Let's go back to, I think we've probably covered most of this. How are we doing for time? 12:26 or what is it? 2:26 for you guys? We taught, here's your grade components, right? So it's on page What page is this on? Do we not have our pages listed? It's under, it's the first section under the course materials, classroom policy, grading components. Here it is right here. Okay. We already went through all this. HESI, late, you already know about late work. Here's the estimated hours based on 2 credits that we anticipate. And we work with our curriculum team, national curriculum team, to establish this. Okay, based on 2 credits. Okay, and then we went through the weeks. Okay. The one thing, okay, I'm going to get out of here. And then I want to go into a module or one of, let's see. Okay. I know I opened up, those are my 2 grandbabies. All right, I did open it up. Okay, so here's our Monday class. Okay, so you guys all know how to go through your shells, correct? I didn't have a lot of people posting in the course cafe. And can somebody explain why I said that?
So that you know that we were getting the announcements and that we read the welcome
Yeah.
letter.
Yes.
Can we see like everybody else's post, or can you only see our posts in there?
I see everybody's post in there. I don't know if you guys can see it. Can you?
I don't know. I posted on it, but I didn't see anybody else's, but I could have been the first person that posted. So I don't
Okay.
know.
So if you don't know what we're talking, if you don't know what Brittany and I are talking about, hang on, I'm gonna, 1 second. Hang on 1 second. I'll be right.
That was the first time I've ever used that course cafe. So I have no idea.
I was able to see
See
the
the
post.
poster there.
Because I know I don't get notifications for that, but like when we do discussions posts, I'll get an email saying that we've all posted on it. But I've never used the course cafe in any other class, so I didn't know.
Oh, sorry about that. Okay, so let me go into, well, let me go back to share and go into the module. Okay, so in your first announcement, your welcome announcement at the very end. Okay, let's go in there. For those of you that missed it, it was the very first one. Okay, so it was sent over the weekend. All right, at the very end, it said, to test if you've read the entirety and acknowledge the understanding of this course, please post in Course Cafe one thing you do for self-care. Okay, I only received 3 or 4 from this class. So if you haven't done that yet, I would appreciate if you could do that. Okay, and here's the PowerPoint that we just went through on this announcement. Okay, so that is your welcome message. Okay. Then I sent you the cover. I'm just going through the announcements. I sent you the syllabus cover sheet. Okay. And then I sent you the expectations, online expectations. Okay. With regards to being on time, being present, wear appropriate attire, choose a good location. Okay. So I really would like for you to take a look at that. Okay. Then I sent you PowerPoints. Okay. I'll send you this every week. It will come every week. You'll get week 1 PowerPoints, case studies, and Kahoot activities. Okay. The case studies are really important as well. They're as important as the PowerPoint. Okay. These come up in my lesson plan and I share them with you. What I want you to focus on with the case studies are the rationales. That's where I think we get a lot of learning from.
Hey, Professor Marvel.
Yeah.
The Kahoot,
Mhm.
when it loads, it's at the awards thing. It doesn't let you do any Kahoots.
Okay. So it's at the end. So it needs to be reset. Okay. Okay. I send you a Kahoots for every week with, I don't like to not waste time, but I don't like to use the class time to do Kahoots. I like for you to do them. I know it's a competitive kind of game thing, but I like for you just to go through them at your own pace, to be able to read the rationales, read the questions. And if we want to talk about them after the fact in the next class, or if we can do that. Okay. So with each week, you're going to get chapter PowerPoints, which are taken right from the book. Okay. And you'll actually see that you'll notice that the objectives in the PowerPoint, which is usually slide 2, are the same objectives in the chapter in the book. Okay. So the PowerPoint is developed right from the book. Okay. So the PowerPoint, I always tell my students, is like an outline. PowerPoint is an outline of what the book is. And then I'll further target in the PowerPoint what we have to pull out from the book to know what particular topics. Okay. So the only thing I really would like for you to do before you come to class is just take a look at the PowerPoints. You don't have to memorize anything, but many times I have students that don't even know what we're covering. Like if I say, guys, what are we covering today? On a Monday morning? That means nobody's looked at anything, which means that every bit of information I'm going to provide is brand new to you. You know, it'd be nice if you just did a little bit of legwork, a little bit of review work to know, just have a look at the PowerPoints and have a look at the case studies. Make sense? Because otherwise this can get really overwhelming really quickly if you don't keep up. Okay, so you'll get that from me every week. It will be week 1 announcement. We'll do the announcement. I usually introduce the topics we're covering. Then I go through what homework is due. Then I go through what else is due. Okay. Your professional development plan is due on the 17th. Here's our Zoom. I've given you two documents for this week. Here's your rubric for your professional development plan. So that's how I'm going to grade it. But what I really want you to focus in is this template. I gave you an easy template for your professional development plan. Okay. You just have to fill it in, and that's what we need. That's what I need. If you use this template, it's super easy. The template goes right along with the rubric. All right. Yeah, Brittany, go ahead.
Do you just want us to fill it out on that template you sent, or do you want us to?
No,
just
you have to
let us
save it to,
outline and go?
yeah, you have to save it to a Word document
Okay.
and submit it. But
Okay.
I tried to make it a little bit easier for you guys to have a template to work with. That's not in all the classes. So, you know, I really, really try and help you guys out as much as I can. I can't do it all for you, but I really like to kind of do as much as I can without, you know what I mean. Okay. So that was your week 1 announcement. And then here's your resources. I give you your math resources, your APA resources, and then math, DOS, and calc. If you don't have time to look at it now, that's fine. But as we get closer to the exam, you might want to use it. So these are resources that I hope that you save and use all term. And then I have a whole group of more resources that I'll send you in the next week or so. It's from Elsevier, and they're test taking strategies. It's a bunch of PowerPoints, critical thinking. How do you break down questions? What do you look for in questions? How to answer questions. It's really, really neat. It's really cool. I don't want to send this out in week 1 because you'll be too overwhelmed, but I will provide you all of that as well. And that will help you through the whole term. Okay. And then I was just asking you acknowledgement of announcements. Okay, I know you're receiving a lot of information, but just please let me know that you're receiving them. So you can tell who's spent time looking at the class so far and who hasn't. All right, so it's pretty easy to tell that. I can see who's in the, I can see here people. I can see just, and not that I'm always looking, but You can see who's in here and what time you were last in and how much time you've spent, so I can get a good idea if students are falling behind, or, if I'm getting emails that they're asking questions that I know are in the announcements. I'll refer them back to that. Does that make sense? And I don't check that. I really don't, unless there's a problem and I'm concerned that the student's not catching on to something. So that's all the announcements you have for now. Okay. Modules. Let's go to that. Okay. I'm going to go into student resources here. I like to go into student view a lot because that way I see what you see. Okay. So this is what you see, right? So I can go in and see your version. All right. So if you ask me questions, I will be happy to answer them, but I am really going to direct you back as much as I can to these student resources if it can be answered. Okay. You guys have a ton of resources in this student section. Okay. Does anybody use their student section resources? Do you guys use those? You should. You should. There's your book, right? And I'm amazed at all these resources you guys have. You guys have a writing center to teach you how to write APA style. You have a library. How to register for next, you guys should already be registered for next gen, right? You should have done that last term. Is that right? You guys know what I'm talking about? Okay. If you don't, let me know. And then here's your welcome. Okay. So getting started, here's your check, your literacy check, and your syllabus quiz. This has to be done before you start. Okay. Right there. And then here's my page. And then here's your course cafe to put in what I asked you to do in the welcome announcement. I just like to see who's reading things all the way through. Anyway, so, okay, I can't get in here. All right, because I'm in the student view and I haven't completed this. So I'm going to go back to my version. All right. But that's why it's all gray. That's what I think it was Octavia who's telling, it's all gray. You can't get into any of this. Okay. So if you haven't done it yet, do it, please. All right, let me get out of here and leave student view because I want to go through modules. Okay, so we're here. Getting started here, same thing. So week 1. So today, what you should do every weekend before class, I would suggest just one off. I would go through these slides in, say, week 1. So for example, right here, week 1, overview. Just start the overview. And you'll just link to each of these 1, 2, 3, 4, 5 pages, right? So if you go into week 1, this is what we're doing now. Tells you what we're going to be covering this week. Okay. Or what I'm going to do a recording on. Okay. There's always a to-do list, what you got going. Okay. Next, if you just do this, you understand what's coming up the upcoming week. So here's your reading, week 1 reading, 1, 2, 3, 21. It's also on your syllabus. Okay. The one thing I will mention for this week is I'm going to divide you up into groups. Okay. You have 2 group activities. This is one of them right here. Healthy People 2030. It's due in week 3. Okay. I want you guys as a group are going to need to explore. What I'd like for you to do is explore Healthy People 2030 website. Okay. You are going to have, we have to go to week 3 to find it, a case study to do with your group. And I'll show you. By the end of probably Thursday or Friday, you'll have your groups. I'll send out you have 2 group projects to work on. This is one, and there's a case study in like week 7 that you work on as a group. I split everybody up. You guys are responsible for communicating with each other, dividing up the work, and turning in a product. Okay. This sheet I would like for you to review. It's a Healthy People 2030 website. So that's what we need to do for this week. Here's your link to your textbook. All right. I don't want to get into this now. I'll go through the textbook and the recording. Okay, so let's back out of that. Have a look at all these chapters that we're going to be covering in the textbook. Okay? It's everything we just went through in the syllabus. Okay? Then professional development plan. Okay, here's your, I've already sent you in the announcement, the rubric and the template, but here's the details. Okay, so that's where you find them in this overview. Here's the rubric again. Okay, and then here's the attestation. Okay, so we're going to do this in a minute. Okay. I think next is week 2. So let's see what comes up next week. Okay. So you have your overview page. What are we going to cover? Okay. What is our to-do list? Okay. So next week we have a discussion question, week 2. So we all know that your discussion initial post is due next Wednesday. So a week from Wednesday, you're going to have an initial post due, right? And your responses are due on Sunday. And then next week, you're going to have an NCLEX, an NCLEX set of questions. And I want to go see what Sarah was talking about. Here's your readings. Okay, next should be your link to the book. So if you just do this on Sunday evening, just to get an idea of what we're covering for this upcoming week. So this is for next week. Okay, top common ailments seen in children. Here's what they are. We give you a list of them. Read this. It says, choose 3, right? Choose 3. Just to be clear, you have to discuss a few things with each of them of your 3. Discuss signs and symptoms, discuss health consequences, and you have to have a 6-point education plan that you'll use with parents for all 3. Okay, so you have to read the details of what you need to do. Otherwise, you just get marked down the rubric. And then here's where we suggest what you might offer your peers. In response to your peers, you might offer how you would use these tools to develop a care plan for the patient. So you're reading somebody's initial post and signs and symptoms, health consequences, education plan. Now the response says, hey, maybe you could just talk about how you would use these tools to develop a care plan for the patient. Okay. What else do we have going? Okay, NCLEX. Okay. So this should look just like last term, right? You select we provide you the information on what your subcategories are right here, right? I have to go in and get an answer to Sarah's question. All right. So, but you will always find the subcategories that you're to pull your questions from. And I need you to select 50 questions. We can't do 5 groups of 10. We can't do 2 groups of 25. And I'm sure your previous instructors have said this. We need 1 group of 50. Okay. So that would be for next week, and then our attestation. So this week, I need you to go to week 3 because let's see, week 3 is going to be, and there's a whole sheet that will explain this, but this is what's going to be due in week 3 that you're going to be starting on this week with the groups. Okay. And whatever week these 2 group projects are due, that's where all the information is. So I might introduce it in week 1. It's due in week 3, but all the information is going to be in week 3. So I'm going to break you guys all up into groups. You're going to be groups 1, 2, or 3, and you're going to be asked to do a case study. So you have to coordinate that amongst each other. And that's all. When I send out the group email, all this information is in here. I just wanted to let you know it was coming. Okay. Okay. So I just wanted to cover weeks 1 and 2. I don't want to confuse everybody. So what do you guys think about that? Is that helpful to go through it like that? What are we thinking here? What are you guys thinking?
It's helpful to go through it like that.
Okay. Okay. So a couple things. One is I'm going to send you week 10's PowerPoint and case study. Okay. I'm going to do that. I'm going to send you groups by the end of the week. I'm going to figure out NCLEX. Okay. I'm going to figure out Kahoots. Okay. And I'm going to do a recording. Okay. I mean, I probably won't do the recording till Wednesday because I've got class tonight and tomorrow morning. But I'll do it. You'll have it by Wednesday. And that will be, I'll add week 10 into it. That'll be weeks 1, 2, 3, 21, and 10. Excuse me, chapters 1, 2, 3, 21, and 10. Okay. But you gotta watch it.
So will you be sending us the PowerPoint for chapter 10?
Yeah, I'll do that today. Yep. Yep. And I'm just going to send it to your group because I don't want to confuse my next 2 classes. I don't want to send until after. Brittany.
So just to verify with the NCLEX, you don't care if we do them ahead of time as long as we don't submit them
Don't-
before they're due.
Correct.
Okay, I just wanted to verify that because I know
Because if you
last
submit
quarter-
it, I grade it in that week.
Yeah, I know last quarter he didn't like it because the dates were too far apart. But so that's why I just wanted to verify that.
Yeah.
Okay.
All right, everybody pull up your attestation page for week 1. Okay. Everybody have it? Let's just get it done. What's the policy for late work and percentage deduction if not turned in on time? What is it? Somebody tell the rest of your teammates what the answer to that is.
10% by day, well, you have to have
What's-
permission first.
What's number 1? Yeah, permission first is number 1. Yep.
And then 10% by day 7 and then 0 after that.
Okay, so that's your answer. So type that in. Then your
Sorry,
second question,
I didn't hear anything you
Okay.
said.
can you repeat that?
I said that you had to have permission first before you could turn it in, and then it's 10%. 10% is taken off all the way up to 7 days, and then after 7 days, it's 0.
Second question, what's primary care?
Prevention.
There's a fancy definition in the book, but what's other than prevention, what's primary care? It's prevention, right? But what else is it?
Disease. Before it
Education.
starts. Education.
Yep. And then when you're done, just hit submit. And you don't have to worry about it. Questions? You guys, whoever, if you haven't done the syllabus quiz, get in there and do it so you can get access to all the information you need, please. I don't want you to fall behind. I really don't. And again, I really look at this course as kind of a change of pace for you guys. Enjoy it. I mean, you may never work in community nursing, you may, but if you don't, I mean, you'll learn why community nursing is a critical part of the healthcare system in so many different roles we're going to cover. So anyway, questions, comments? I'm excited. I'm excited for this term. I hope you guys are. I know it's busy. I heard this last term. Last term was the first term that the group had med-surg and peds. It was, you really have to have some good organizational and time management skills. You really do. And I'll work with you I don't want to make this class difficult for you. I really don't. It's not a difficult class. If you just spend a little bit of time each week, keep up with the assignments, you'll be fine. And as far as our exams go, our study guides are wonderful, wonderful representation of what you'll need to know for the exam. So we'll spend time on the study guides as well. Okay. There's 32 chapters. It's too big. You're not expected to know everything. We pull out a few things from each chapter and there are a couple of chapters that are pretty involved, that have quite a bit of questions on the exams, like, vulnerable populations and big things in community health, education, but a lot of the other chapters may have 1 or 2 questions on the exam in it. We'll try and focus on those areas so that you're not having to read every chapter from front to back. So I have that all organized for you. So we try and teach the most important things in community health. So don't be overwhelmed at 32 chapters, and, we don't need to know everything. And I like to highlight in the book the sections that we need to know. Okay. So, yeah, you guys will be fine. It's changing. Look at it, a change of pace. All right. You learn what happens out in the community. Think about, do you guys know how your community functions? Do you know about environmental risks and public health and whose your vulnerable populations are? And, we all live in a community. I don't know how much you know about, I don't know a whole lot about, I should know more about my community, but there's a lot that we don't know. Right. So, yeah, I had a blast as a school nurse for 20 years, and I was considered a community nurse, but I was also considered, an infectious disease nurse. I mean, you wear a lot of hats. As a school nurse, you wear a lot of hats. Immunization nurse, infectious disease nurse. Yeah. So just embrace. It's a 2-credit class. If you just stay on top of it, it'll be fine. Do not get behind on exam 1. Do not, because then you're playing catch up. Okay. Know your study guide. Try and attend a review session or 2. You'll be fine. I promise you. I promise you, you'll be fine. Okay. And I'll work with you whatever support you need from me, you got it. Okay. You do your part, I'll do my part, and we'll get across the finish line, all with big smiles. Okay. All right. I'll stay 12:54. How about 6 minutes for a gift of time? What do you think? I'll stay on after in case anybody has any questions. But if you have any questions going forward, just shoot me an email. Okay. You got a whole bunch more announcements coming, but I got to get through my next 2 sections first. So all is good. We'll have fun. We'll have fun learning about what we do in the community. There's a lot to know. A lot we can do in the community to help. Okay. Bye. See you next week.